if I could just ask Paul Clement to, in a sense, set the table with a brief description of what the individual mandate is and what the heart of the constitutional challenge is.
Sure, I'll give it a try. I think maybe Neal would have a different way of describing it, but probably not too different. The key provision here that has generated the most controversy and the central constitutional issue that we're here to discuss is the individual mandate, which essentially requires, with one or two minor qualifications, every individual in the country to obtain qualifying health care insurance. And this is something that certainly the framers of the Act, when they were putting it together, thought was critical. They'd looked at some states that had tried to do other insurance reforms, including trying to make sure that insurance was available generally to everybody and that you wouldn't be denied insurance because you had a high-risk condition. States that had tried that without an individual mandate had run into problems. At least one state, Massachusetts, had tried it with an individual mandate, and it was perceived as being more successful, so it was perceived that the individual mandate was quite critical. I don't think it was perceived by everybody that it was the only way to accomplish adequate health care reform. There were earlier versions of the Act that kind of more affirmatively embraced the taxing power and the taxing authority, but in the end, it was settled that the Health Care Act would pass and it would include this individual mandate. What I think gives rise to the central constitutional issue is the starting observation that this was really a fairly unique or completely unique, depending on your perspective, provision of law. There have been a lot of crises in this country over the years, that economic, other, where Congress might have thought that forcing individuals to purchase a particular good or a particular service might be a useful means of government action, but the government never did it. I mean, just to take an example that has always resonated with me because it's so recent and it seems to me so obvious that a compelled purchase would have been an even more effective regulation. There was the famous Cash for Clunkers program involving a series of incentives to get people to help the car industry by giving them incentives to purchase cars. It seems to me it would have been much more efficient and effective for the government in accomplishing its objective of boosting the automobile industry to simply say that everybody over a certain income level just had to buy a car. Much more direct way to accomplish that objective. The government has never really seen fit, at least at the federal level, to do that kind of direct requirement that individuals engage in commerce. And so that's what really gives rise to the basic issue here, I think. You know, the government, the federal government on its behalf suggests that this is, although I think they concede that it's a largely unprecedented action, I think they suggest that it's a fairly straightforward regulation of commerce supported by the Commerce Clause. The challengers, on the other hand, point to both the unprecedented nature of the imposition and the government's seeming inability to articulate a limiting principle such that if you could engage in this regulation, what regulation couldn't the government engage in? What commerce couldn't they force you into in the name of better regulating commerce?